Good morning, Mr. Chair and members. I'm presenting SB 229, which is a straightforward bill to provide $500 million grant funds to our schools to provide mental health services to our students negatively impacted by COVID-19 school closures. My amendments make the Department of Education the lead agency and establish necessary reporting requirements to the legislature. I want to thank you and your staff for the amendments, working with me on the amendments. Just this weekend, a report on the struggles of our school children in California was released. It stated students in Los Angeles Unified School District are experiencing the painful loss of connection with their peers, teachers, and school staff, and a serious loss of learning that will have lifelong consequences if not addressed. I witnessed this with my own daughter. She wilted when she was forced to do distance learning. This funding is critical, necessary to begin and address the impacts of the pandemic on our students' mental health. School counselors, nurses, social workers, and psychologists are frequently the first to see children who are sick, stressed, and traumatized, especially in low-income districts. A study was released by the Fair Health Foundation that claims for international self-harm as a percentage of the medical claims in the ages from 13 to 18 age group increased from 90.7% in March 2020 compared to March 2019. The increase was even larger comparing April 2020 to April 2019, nearly doubled, 99.8%. Data shows that the presence of school-based mental health providers not only improves outcomes for students, but also can improve the overall school safety. Studies further show that young children show more cleanliness, disturbed sleep, nightmares, poor appetite, inattentiveness, and significant separation problems. This funding stream will help our schools' children throughout the next phase of their lives. Thank you, and I ask for an aye vote.
Okay, thank you so much, Senator Dali. I do not have a lead support witness to provide formal testimony, so we'll go ahead and move to additional testimony and support. We'll begin in the public gallery. Again, this is support for SB 229. Seeing no one at the public gallery, let's move to room 2040. Seeing no one in room 2040. Moderator, please open the lines for witnesses who wish to testify in support of SB 229.
Thank you, Mr. Chair. For comments in support of SB 229, please press 1, then 0. That command again, 1, then 0. And Mr. Chair, we have no comments at this time.
Okay, we'll now move to opposition. We do not have any lead opposition witness to provide testimony in opposition to SB 229, so we'll then move to additional witnesses in opposition. Move up to the public gallery. Seeing no one in the public gallery to testify in opposition to room 229, let's move to room 2040. Seeing no one in room 2040, let's move to the telephonic line. Moderator, please allow witnesses who wish to testify in opposition to SB 229 to come on the line. And again, it's name, organization, position only.
For comments in opposition to SB 229, please press 1, then 0. That command again, 1, then 0. And Mr. Chair, we have one comment coming through. One moment while we provide them with their line number. Just be one more moment, please.
Okay.
All right, and line 239, your mic is open.
Okay, please begin.
Line 239, your mic is open. Please check your mute. I apologize, Mr. Chair. There seems to be no one on that line.
Okay, very good. All right. Actually, before we bring it back to the committee, I want to welcome Senator Limón. Welcome, and thank you for joining us. So you are joining us remotely. And so first of all, I want you to introduce yourself and then also indicate if there's any staff with you. If there are, the name of the staff person who's with you. So Senator Limón.
Thank you, Chair. Senator Limón. I'm in the district office, and I have Benjamin Peterson, a staff member, with me.
Okay. Thank you, Senator Limón. And I think you probably are already quite familiar, but just quickly, the instructions are to mute your device when you are testifying so that we don't have acoustic feedback. Thank you so much, Senator Limón. All right, now let's bring the discussion back on SB 229 to the committee. Are there questions or comments from committee members? Okay, Senator Rubio.
Yes, thank you, Mr. Chair. I want to commend Mr. Dahle, the great senator, for bringing this forward. I understand why he's bringing this bill forward. As a former teacher, it really is something that we need to put a lot of focus on. I know as teachers, a lot of things fall on our shoulders. We're expected to be therapists, nurses, social workers, everything that we are not qualified to do. And I think that some people assume that it's going to be a seamless transition for children coming out of COVID isolation into our school systems. But yesterday I heard a story from one of the students, and that is that this little girl had been playing by herself out in the playground, even though they're back, even though their peers are back, but she still has the trauma of feeling that if she plays with kids, touches kids, that her life is in danger. So that really opened my eyes as to how deep rooted the trauma is going to be even after they come back, and we assume that it's quote unquote normal. But they're still dealing with that fear that for the last year we've instilled in them about social isolation and distancing and everything else that comes with, what we've experienced the last year. But I just wanted to say thank you to the author for thinking about this issue. Certainly we can use help in the school systems. Thank you, Mr. Chair.
Thank you. Are there any other questions or comments from committee members? Seeing none, Senator Dahle, I just want to thank you for bringing this bill forward. I appreciate your testimony talking about not only the experiences you've witnessed, but you've seen with your own family. I'd make note that I, too, as a father and pediatrician, have also seen the stresses on children as well, including I have 2 children who are attending school, and the challenges they're facing as well. I know we do have several different proposals to address mental health, but I appreciate that you've put forth your own as well for us to consider. Would you like to close?
Thank you, Mr. Chairman and members. I appreciate the comments from my colleagues. I just want to say that I've never done this before. I've never asked for a big budget ask, but I witnessed it with my daughter, and it was painful. Mm-hmm. And we don't know. Our society's never been through something like this, but we do know that we need people. We need each other. And at the end of the day, when I watched my daughter Rosalind just wilt, because even family members we were separated. And so I'm giving this a shot. It's something new for me. I didn't ask for lead witnesses. I know the time frames that we have in meetings all day. We were just in committee together, Mr. Chairman. Yeah. So I was respectful of your time. But I know there's a lot of support for this, and there's many proposals out there. But I want to be on board with trying to help the young people, and those. I can only imagine where there's single parent where they were not able to go to work, or if they were able to go to work, what happened with those children. We weren't in that situation, and I saw firsthand where there was a lot of support. So I respectfully ask for an aye vote. Thank you.
Okay, thank you, Senator Dahle. Is there a motion? I see a motion from Senator Roth. Got his hand up first. So motion from Senator Roth is do pass as amended, but first amend and refer to the Committee on Education. Consultant, please call the roll.
Han.
Aye.
Han, aye. Melendez.
Aye.
Melendez, aye. Eggman.
Aye.
Eggman, aye. Gonzalez.
Aye.
Gonzalez, aye. Grove. Hurtado. Leyva. Limón.
Senator Limón, SB 229, aye.
Limón, aye. Roth.
Aye.
Roth, aye. Rubio.
Aye.
Rubio, aye. Weiner.
Aye.
Weiner, aye.
7? So the current roll is 8-0. We'll put the bill on call. Thank you.
Thank you, Chairman and members.